Hi, so again, my name is Melissa Weistuck. I'm the Marketing and Communications Manager here at the New York Proton Center. And I'm thrilled to see so many people interested in this really important topic about holistic wellness for cancer survivors. We have two speakers today, my two amazing colleagues. Alisa Ryncarz is a nurse practitioner with experience in both inpatient and outpatient oncology. She primarily works with our breast and lung cancer patients. Chrissy Rubin is an oncology social worker who works with patients on both the practical and the emotional supports during cancer treatment. I've got a few housekeeping matters as well. Please place all of your questions in the chat and we will answer those after both Alisa and Chrissy have presented. As I mentioned, the presentation is being recorded, and I hope by next week it will be on the New York Proton Center website on the alumni page for anyone who would like to view it. Finally, please reach out to me. Are there topics that you would like to hear about? You know, we're always looking for topics for webinars, or I hope someday in-person events, and it would be really helpful to know what really resonates with all of you, our alumni. And with that, I'm going to turn it over to Alisa.
All right. Hello, everyone. My name is Alisa. I am, like Melissa said, a nurse practitioner here at the Proton Center. And I work with two of the NYPC physicians that we have, primarily in breast and thoracic cancers, but I have previous experience from the medical oncology side in the outpatient world. So that really is what makes me qualified to talk about cancer survivorship, which is what we're going to be discussing today. So cancer survivorship is care during cancer treatment that focuses on the health and well-being of a person with cancer from the time of diagnosis until the end of life. It includes physical, mental, emotional, social, and financial effects of cancer that begin at the diagnosis and continue through treatment and beyond. So this is a field that we've seen a lot of growth in the past couple of decades, especially as our diagnosis and our treatment has improved, which is allowing a larger amount of our cancer patients to survive for many, many years after the initial diagnosis. So this field kind of was created to address the needs of those patients. We're going to be reviewing that today. So survivorship care. There are a couple principles that we're going to focus on that is recommended by the NCCN, or National Comprehensive Cancer Network. So the first thing we'll talk about is the prevention of new and recurrent cancers. We'll talk about routine testing for the return of a cancer, what we call surveillance, routine testing for new cancers, what we call screening, prevention, assessment, and treatment of late effects of cancer treatment, and as well as the importance between coordinated care between providers. We know that everyone who goes through a cancer diagnosis ends up having a team of many different people between medical oncology, surgical oncology, consulting providers like pulmonary, things like that. So it's really important after the acute treatment phase to have coordinated care between all of these doctors. So the first principle of survivorship care we'll talk about is the prevention of new and recurrent cancers. So depending on your cancer type, sometimes we use medications or even surgery to prevent cancer from coming back. And this can happen in combination, or it can even happen after the acute treatment phase is over. For example, breast cancer patients who have, say, a hormone receptor breast cancer are sometimes given an anti-hormonal medication they take for years. So that's one of the primary ways we can help prevent recurrent cancers. The other way, which is more patient-centric, is by living a healthy lifestyle. And this is something I'll talk about the recommendations for in greater detail later in this presentation. The next tenet of survivorship care is routine testing for new cancers. And this is something that's very patient specific. So you want to make sure that you're asking your healthcare provider what screening, if any, is needed. This is also something you can educate your friends and family members about, because all of us, once we reach a certain age or have certain risk factors, should be screened for new cancers. Sometimes the causes of the first cancer may be related to getting a second cancer. So again, for example, if you have breast cancer and you had a smoking history, that might put you also at risk for something like lung cancer. So it's important to talk to your provider about those extra screening techniques that may be indicated. Sometimes the cancer treatments you go through, such as radiation here at the Proton Center, which is part of the utility of protons in general, those treatments can increase cancer risk in other parts of the body. So we want to make sure we're doing adequate screening techniques for that as well. Additionally, sometimes patients, when they're going through cancer diagnosis and treatment, they have genetic testing, which can sometimes reveal a genetic abnormality that may put them at risk of other cancers, such as breast and ovarian cancer, colorectal cancer, prostate cancers, or even pancreatic cancers. If this is something that happened during your diagnosis and treatment, you want to make sure you're either talking to your primary medical oncologist or talking to a genetic specialist as well to make sure you're addressing the exact screenings that are required. The last part of testing we'll talk about is surveillance. And this is kind of the what happens next after you finish the acute phase of treatment. Generally, a lot of patients fear recurrence or that original cancer they had returning. The main tenet of this is by going to your follow-up visits. The way we monitor is by taking a history and physical exam. For my breast cancer patients, we used to always say, if you have a new symptom that's been present for 6 weeks or greater, and you don't have a very clear cause for it, that's something that we want to hear about either at a follow-up visit or in between a follow-up visit, because then some sort of imaging or blood testing might be indicated. For other cancers, such as lung cancer, imaging is standard and recommended after the acute phase of treatment. So by going to your follow-up visits with your main primary provider, be it a radiation oncologist or a medical oncologist or even a surgeon, they're able to make these recommendations of how you're going to monitor for a recurrence. The last principle of survivorship care is the prevention, assessment, and treatment of late effects of cancer and the treatment itself. Many effects of treatment resolve quickly after the treatment ends. So nausea and vomiting, if you're on chemotherapy with radiation, we'll talk about maybe skin toxicity that resolves within a couple of weeks. But sometimes from these treatments, patients can experience long-term side effects, such as heart effects from chemotherapy, sometimes peripheral neuropathy or numbness or tingling of the hands and feet, sometimes lymphedema, which is related to generally surgery, and sometimes radiation and a blackup of lymphatic fluid in the body. And even slower over time, we can see bone density changes related to medications. The most important part of this is early identification and treatment. So this is another reason you should make sure you're staying up to date with your follow-up visits with your oncology team, because those providers are going to be the ones who are the most well-versed, even over a primary care provider, in monitoring for these effects, and they'll be able to early diagnose them and provide treatment as needed. So the NCCN, as I mentioned earlier, is the National Comprehensive Cancer Network, and they are the governing body when it comes to cancer care here in the US. And because survivorship has become such a large field, they've put out practice guidelines that delineate exactly what is recommended for patients in this phase of treatment. We say survivorship after you've finished the acute phase of treatment, but really cancer survivorship guidelines pertain to all survivors of cancer from the day after diagnosis, whether they're on active treatment, whether they've stopped treatment, whether they've finished it. It pertains to everyone. And the main thing we're going to talk about today in specific recommendations is the healthy living recommendations put forth by the NCCN. And if you'd like to learn more, do some more reading on your own, the NCCN has a great patient guidelines website regarding survivorship care, as well as specialty guidelines on different types of cancer. They are a great resource. You can access this link online if you'd like to. All right, so how do I live a healthy life after cancer diagnosis? The goals of healthy living are as follows. You want to be as physically active and avoid inactivity, eat healthy foods, limit or avoid drinking alcohol, achieve and maintain normal body weight, don't smoke, chew, or sniff tobacco, practice sun safety by using sunscreen and do not use tanning beds, and get enough sleep. The ones highlighted in red are the ones I'm going to focus more specifically on today. First up is physical activity. So the general guideline is to move more. Physical activity is safe and improves the health of most cancer survivors. Our goal is to get you more active, be it with routine activities such as household chores, recreational activities such as swimming, and intentional exercise such as brisk walking. We know that cancer and its treatment may limit the physical activity of survivors, but with the right support, many patients can increase their activity. The main thing is do not hesitate to ask for help. Physical activity is safe, helpful, and can be achieved by almost all of our patients. So why is this so important for cancer survivors? I pulled a piece of research just to help exemplify to you guys in this group kind of the importance of actual numbers that we see in research supporting physical activity. I've highlighted two studies here. They're a bit older, but they're looking at large groups of people with both breast cancer and colon cancer. And this study shows the very clear reduction in risk of recurrence and mortality in cancer for these patients who have increased physical activity. So other than reducing the risk of recurrence, so the risk of the cancer coming back or the risk of mortality from cancer, physical activity has additional benefits. It can improve your cardiovascular fitness and lower the risk of cardiovascular events such as a heart attack. It can improve your muscle strength, improve your balance, give you a healthier body composition, which is defined as kind of the fat, muscle, bone, and water content of your body. Most importantly, for our cancer patients, it can reduce fatigue. Even when you're on treatment, physical activity is one of the few things that can help combat chemo and treatment-related fatigue. It can also improve your emotional well-being and your overall quality of life. So what exercise is enough exercise? The NCCN defines the goal as 150 to 300 minutes a week of moderate intensity exercise, which I know sounds like a lot. If we look at moderate intensity activity, that really just means movement where you can talk, but you can't sing. That middle column in the chart to the right has some examples, and brisk walking is one of them. What I used to always tell my breast patients is 30 minutes a day, 5 days a week, go for a brisk walk. That can be 10 minutes with breakfast, 10 minutes with lunch, 10 minutes with dinner. That's all that we really need to do to reach this goal as recommended by the NCCN and thereby help reduce the risk of recurrence and mortality. If you're doing more vigorous activity, say high intensity yoga, going for a run, the recommendation to hit is only 75 minutes a week. And you can do a combination of both moderate and vigorous activity. So this would be a good slide to go back and reference later on if you want to just kind of jot down what the exact goal is. You might hear that and say, I don't have enough time for that. I don't have space in my home and I don't know what's safe for me to do. I am handling XYZ side effect from my treatment and I don't think that I can do movement right now. The best way to know what is safe for you is to be evaluated by a professional. There's physical therapists and occupational therapists who are trained in post-cancer care. There are certified exercise professionals and rehab specialists that can all help assess you and give you good guidelines on what to do. Most cancer survivors can exercise safely, but sometimes that trained professional is needed. Your radiation oncologist or your medical oncologist or surgeon can all provide referrals for you. And especially if you have any of the conditions listed on the lower right portion of the slide, just check in with that provider and see what is the best recommendation for you. So overall, strategies for success for physical activity. I'm going to say learn what stops you from being physically active. Find ways to overcome barriers and get help if needed. See a provider trained in exercise if indicated. Have a plan for physical activity that is tailored for you. Set short-term goals to achieve long-term goals. Find support from an exercise buddy or class and use a fitness device to track activity. Another great resource, which I don't have linked here, but YouTube has a ton of videos for post-cancer exercise care, and you can search specifically to your type of cancer and see what's out there. MSK, I believe, also has some great resources on their website as well. All right, the next thing we're going to talk about is food and supplements. Healthy eating. We know that eating a healthy diet is key to good health, and cancer survivors are at risk for not eating the foods that they need. Cancer itself, cancer treatments, and stress of diagnosis can change survivors' dietary needs and eating habits. To make good choices about food, it's important to be aware of both nutrients and food groups. So I'm going to give a brief overview of that. Apart from water, there are 5 main essential nutrients. We group those into macronutrients, which are bigger, fats, carbs, and proteins, and micronutrients, which are vitamins and minerals. Each macronutrient serves a vital function in your body. Your body needs fats to grow cells, make hormones, absorb vitamins, provide energy, and keep warm. Your body needs carbs for the main source of energy for every cell. And proteins are very good for helping build and repair body tissue, fight infection, and provide energy. There are good fats, carbs, and proteins that you should be eating every day, and those are highlighted on the right in the yellow box on the right side of the chart. The NCCN recommends a healthy balance of all macronutrients, which can be attained without tracking macronutrients, because a lot of people find that overwhelming of looking at something and saying this has 5 grams of carbs and 10 grams of proteins and 30 grams of fats. You don't need to do that. What we can look at is food groups. Excuse me. Food groups make choosing healthful foods easier. For a healthy diet, eat a variety of foods from all food groups. Excuse me. The amount of food needed in each food group varies among people. It depends on factors such as your age and how active you are. You can go to the NCCN approved resource, choosemyplate.gov, to figure out more information about how this pertains to you. All right, healthy eating. Why is this so important for cancer survivors? So again, I pulled a piece of research just to highlight this. I won't go into the nitty gritty. Feel free to read this at your own time. But this was a very, very large study, basically showing that people at a higher dietary quality, they had better outcomes and less mortality from cancer. Those who adhere to the Western dietary pattern, which is one that focuses more on processed foods, more on candy, sugar, high sugar drinks, they have a higher risk of mortality. We know that vegetables and fish also decrease mortality and alcohol consumption increase mortality. It's what you would guess. But basically, this is why we know that cancer survivors should be eating and focusing better on a healthy diet. Food goals. This is the set of guidelines set forth by the NCCN. You want to make sure you're avoiding empty calorie foods, which is defined as foods that have many calories and few nutrients. Instead, you want to focus on nutrient-rich foods. At least half of your diet, you want to be plant-based foods. So vegetables, beans, fruits, grains, nuts, seeds, and oils. For animal-based foods, you want at least half or less of your diet to be based in that, and that could be meat, poultry, fish, eggs, milk, and honey is listed under that. Fish and poultry are healthy choices, and we do want to make sure you eat limited amounts of red meats and avoid processed meats. Overall, you want to limit eating processed foods and ultra-processed foods, limit or avoid consuming alcohol. For women, the research supports 1 drink a week and 2 drinks for men. Supplements are something I get asked all of the time about. It's a very hot topic in post-cancer care and cancer survivorship. Supplements are not medicines. They're not intended to cure, treat, or prevent disease, and they're not approved by the FDA. But there is a decent amount of emerging research about different supplements. The most important thing to remember with supplements is we don't know their safety, especially if you're on active treatment or have a recent cancer diagnosis. The most important thing to do is to talk to your provider. You want to make sure you're not taking anything that could potentially be harmful to you or even increase your risk of cancer recurrence. If you have questions, make sure to ask your medical oncologist or see a nutritionist or integrative medicine specialist in consultation. There is a great resource from MSK. You can access it via the link in the slide. Lastly, we're going to talk about weight and metabolism. Weight is an issue for many cancer survivors. Weight change may worsen a survivor's health and quality of life and may impact recurrence and survival. There are 3 goals for cancer survivors. We want to achieve a normal weight, maintain a normal weight, and most importantly, strive for metabolic health. What is metabolic health? This is a term used to describe how well we generate and process energy in the body. So how do you know if you have an unhealthy metabolism? Basically, if you have a diagnosis of metabolic syndrome. This is a diagnosis made when a person has 3 of 5 of these unhealthy metabolic conditions. This is a large waistline, so for women greater than 35 inches and for men greater than 40 inches, high blood pressure, high blood sugar, high triglycerides, or low good cholesterol, the HDL. The best way to improve your metabolic health is to live a healthy lifestyle. This also helps lower the chance of heart disease, type 2 diabetes, and stroke. So a last bit of research I'll share with you today is why metabolic health is important for cancer survivors. This was a review done in 2022, and this showed that metabolic dysfunction, so that unhealthy metabolic syndrome, has been associated with an increased risk of mortality from colorectal, pancreatic, postmenopausal breast, and bladder cancers. So this is something that's really, really important, especially in the survivorship setting, to be aware of. Even if you're in that normal weight category and you have 3 of those risk factors, you still have an unhealthy metabolism. So it's something to focus on, and you should be making sure you're getting annual blood work with your primary care provider to assess this. All right, so Here is the survivorship toolkit we're going to talk about for physical care, my section of the presentation. You want to make sure you go to your follow-up visits, complete recommended screening exams for new cancers, engage in physical activity regularly and avoid inactivity, eat a healthy diet of all food groups, reduce processed food and alcohol consumption, and engage in lifestyle habits to support healthy metabolism. And above all, talk to your provider if you have any questions. So that concludes the physical portion of the presentation. I'm going to pass it over to Chrissy, our social worker, who's going to talk a bit more about the psychosocial aspect.
Before Chrissy starts, I just want to remind you all to please put any questions you may have into the chat. Also, let us know if the volume, if you're able to hear us and see everything appropriately. Much appreciated. Thank you.
Good evening, everyone. Again, I'm Chrissy Rubin, and it's nice to see some familiar names joining us today. I'm one of the social workers here at the Proton Center. I've been here for about 2.5 years, and really happy to be able to share with you some ideas on psychosocial supports and tools from the social work perspective. So first, we're looking at all the common fears and worries that people experience as cancer survivors. Will my cancer come back? How do I manage the changes to my body? Will the side effects I'm experiencing go away, or will they linger for a long time? How do I recover from the financial impact cancer has had on me and my family? How do I use my cancer experience to make meaningful changes in my life? Do I want to go back to work? And which doctors should I see now, and how often? So here's 10 actions for you to take. First, stay in the moment. Try to focus only on today's problems. Take a deep breath and take one step at a time. In fact, I'm going to take a deep breath right now. I get a little nervous when I'm presenting, so a deep breath is always good. Okay. Oh, thank you for the comment that we can be heard clearly. Thank you so much. We appreciate that. All right, number 2, we want to help others understand what you need. Let friends and family know what would help you. Make specific suggestions like, let's go to a movie, or I need you to just listen when I talk, or I could really use some help with the kids tomorrow. So I want to go back to that second point. I need you to just listen when I talk. Often family members, friends, loved ones want to be your cheerleader. They want to cheer you up. They want to get you up and get you out and get you moving and doing things. And you might not feel like it. You might just feel like you want someone to listen and be present. It can often be very challenging for our loved ones to be present and to listen and bear witness. Sometimes that's what you need, and it's okay to ask for that. So I just encourage you to do so. Very simple, but simple is easier said than done often. Number 3, acknowledge your feelings. The cancer experience triggers many strong emotions. The first step is to take time to just listen to your body and the things you're saying in your mind. Once you're more aware of your feelings, you can find constructive ways to express them through talking, writing, physical activity, or creative pursuits. And I want to just point out, taking time to think about what your mind is saying. Sometimes the mind can be a dangerous neighborhood. So when you start to feel like you've turned a corner in your mind and you're going down a dangerous block, maybe do a U-turn and go to a different block. Get out of that dangerous neighborhood that your brain can sometimes be. Number 4, do what you enjoy. If you're still able to engage in activities you enjoyed before your diagnosis, keep doing them. Ask friends to join you, or give yourself permission to be alone when you need to be. Sometimes that might be something that's hard to ask for, and that's a very simple request to make, but it can be difficult to communicate. Okay. There we go. Thank you. Always good to have an IT person handy. Thank you, Scott. Okay, number 5, seek relaxation. Relaxation refers to a calm, controlled physical state that will enhance your well-being. The more you practice relaxation, the easier it becomes. Find ways to take relaxing breaks in your daily routine. Listen to some music, do a few stretches, take time to enjoy nature. You might try joining a relaxation or meditation program in your community. Even watching your favorite TV show can put you in a relaxed state. Yes, as your social worker, I just recommended television. Okay, number 6, retain as much control over your life as is reasonable. If you feel you've lost control over things in your life, list the things you feel you've lost control of, then decide realistically what you can take back. So often, when people are first diagnosed and come to our center, they feel like a deer in the headlights. And that is so connected to losing control. So start to think about those things you feel you have lost control of, and then you can really take stock and see, okay, what can I take back and take control of? Number 7, maintain a partnership with your doctor. Aim for ongoing communication and never stop asking questions through the period of follow-up care and into the future. And Alisa referenced this, the importance of communication. Try not, and this is another thing, try not to be intimidated by your doctors. It can be intimidating to walk into a room and have someone come in a white lab coat. They are your team. They are part of your team. So make sure communication is something you can maintain openly. Okay. Number 8, be an empowered survivor. Be an active participant in the care of your mind and body. If you feel better about your choices, you'll improve the quality of your life. And so many of those choices were outlined by Alisa. Number 9, spend time with other survivors. Even though we're not all in the same room, you're here tonight. And so we thank you for doing that. You've made a good, healthy choice, but just by showing up this evening. People with cancer often find a sense of comfort in communicating with others who share their experiences in person, online, or by phone. And finally, number 10, hope for many things. Hope is desirable and reasonable. There are millions of people in the world today for whom cancer is just a memory. Even if your cancer recovery has been complicated, you can find small goals and pleasures in your life. I'll often say to people who feel hopeless, I have hope for you. And I want to tell you that I have hope for all of you here this evening. So even if you can't find that hope, I'll hold on to that hope for you and you can come get it whenever you want. I'll give you my email and phone number. Okay. Managing fear of recurrence. Some people share that ending treatment and having a moment to finally exhale leads to a recognition of all they've been through. They're confronted with some overwhelming emotions they weren't expecting. These emotions may include relief that it's over, a sense of the unknown, cautious optimism, anger or guilt about the cancer, fear that the cancer will come back or recurrence, grief and loss for the old life or body, concerns about living with cancer, discomfort or shame about needing help with a chronic illness, uncertainty about what to do next, and frustration with physical changes. Often when people end their treatment here at the New York Proton Center, they feel a sense of loss because this has become their part-time job, their semester in New York, if you will. And so people feel a sense of loss at saying goodbye to the people that have helped care for them for 5, 6, 7 weeks. So there are a lot of different emotions that you can be feeling. Some people have elevated anxiety when they get close to the date of scans and follow-up tests. This is often called scanxiety, and scanxiety is real, the uneasiness associated with waiting for the results of your cancer scans. You're not alone in having this anxiety. So, keep that in mind. And as you're approaching your next scan and getting ready for those results, that is a time to think about what are the tools that we've learned today? How can I take advantage of those things so that I can have coping mechanisms to get through this period of scanxiety? So here are some tips about coping with the fear of recurrence. As fear of recurrence bubbles up, consider these tips that can help you regain control and manage those fears. Learn the signs for recurrence of your type of cancer. Keep up with any medical tests or appointments your doctor recommends. Talk about it, express your feelings. You don't have to be upbeat all the time, but try to look for the positive. Be empowered, take control of what you can, make a plan, and know what you cannot control. So we talk about this being a holistic presentation. What is holistic anyway? It's relating to or concerned with wholes or with complete systems rather than with the individual parts. And holistic medicine attempts to treat both the mind and the body. And that's where we here at the New York Proton Center have this interdisciplinary team. And that's why you have a social worker.
The quality or state of being conscious or aware of something, a mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations, used as a therapeutic technique. So mind-body techniques. Mindfulness meditation reduces anxiety. I could use a little mindfulness right about now, promotes mental clarity, improves sleep patterns, enhances self-regulation, including attention control and self-awareness. Mindfulness practice enhances attention, it improves emotion regulation and reduces stress. It also has the potential to affect self-referential processing and improve present moment awareness. And it also can improve sleep patterns. And then yoga, gentle movements and stretching can improve flexibility, balance, and overall physical and mental well-being. Yoga has been cited to help reduce fatigue in cancer survivors and improve overall quality of life. And when you think about yoga, it doesn't have to be some power yoga, intense vinyasa workout in, hot yoga or anything like that. It can be simple chair yoga. There are very simple yoga resources online. There are wonderful yoga classes on YouTube as well as what Alisa was describing earlier. And then simple breathing exercises. Deep breathing exercises can reduce stress, promote relaxation, and enhance oxygenation of the body's cells. So your cancer roadmap, this is a wonderful resource. This is a book about navigating life with resilience, a word I love. This was put out by the cancer support community and has some wonderful, wonderful information in it, great resources. It has recipes with great pictures. So it's in general a really helpful book and a wonderful resource that can be ordered online and that you can get through the cancer support community. So these are some survivorship resources. Cancer Care is an excellent nonprofit organization that provides free professional support services and information to help people manage the emotional, practical, and financial challenges of cancer. Cancer Support Community's Cancer Survivorship, that has support and resources for cancer survivors, and then their Cancer Transitions, which is a comprehensive program designed to give you the energy and ability to cope with life after treatment. The program covers psychosocial health, eating well, staying active, and medication management. And then Livestrong has the Road to Survivorship, Living After Cancer Treatment, an overview of the physical, emotional, and practical issues faced by people who've experienced cancer treatment. The National Cancer Institute has Facing Forward, Life After Cancer Treatment. And then the National Coalition for Cancer Survivorship's Cancer Survival Toolbox. That is a great online resource where you can listen to articles on different topics related to living with and beyond cancer. And then cancer.net has Coping with Fear of Recurrence. And then again, the Cancer Support Community, How to Manage Fear of Cancer Recurrence. So emotional support options, support groups are wonderful. They provide a sense of community and opportunity to help exchange experiences and foster emotional healing. There is considerable observational evidence suggesting that online support groups reduce feelings of isolation, depression, and anxiety, and enhance knowledge, coping, and self-management among cancer patients and survivors. Then individual counseling is an option as well to process your emotions, manage stress, and promote overall well-being. Sometimes people are not interested in support groups, so one-on-one counseling is a great option for people who really don't feel comfortable in a group setting. Then there are creative therapies and outlets. Self-expression can really aid in emotional healing. So your survivorship toolkit from a psychosocial perspective, mindfulness, support groups, counseling, connect with your community, communicate with your providers, as Alisa really reinforced, and keep breathing. So any questions can go in the chat. And we again thank you for your patience and your participation this evening.
So no questions, but thank you very much for your feedback about fantastic job, and we appreciate you. And I'll share that with my clinical colleagues here. Are there any questions that anyone would like to ask in the chat? First, okay, we do have a question. Who would I reach out to for counseling and emotional support?
You could reach out directly to me, Chrissy Rubin, and I can then provide you with some individual resources. And I'm happy to provide my direct dial, which is 646-968-9037. Again, that's 646-968-9037. And I'll also provide my email address, which is crubin@nyproton.com. So first initial, last name @nyproton.com. And you'll have access to the cancer care link, and everyone who answers the phone at cancer care is an oncology trained social worker.
Okay, thank you.
You're welcome.
Okay. Any other questions? We'll keep it open. Okay, I think we're good. If we have no more questions, we will end the seminar. And again, our apologies for the technical snafu. I am still aiming to have a recording of the webinar available to you so you can get the links, and also for anyone who couldn't make it today. And remember to please reach out to me. My name is Melissa. Probably have my address in an email, and let me know if you have a suggestion for a webinar topic. Thank you so much.